Hi, I'm Dr. Michael Lange. I am a board-certified optometric physician as well as a certified nutritional specialist. I started Lange Eye Care & Associates March 15th of 1993. We grew to 13 locations throughout the great state of Florida. This is a state-of-the-art eye care center with the latest in nutritional eye care, surgical, medical, and optical eye care all under one roof. I came to Ocala, Florida with $2,000 to my name and a car, and I think it was in the right place at the right time. A lot of people wonder, I don't have any eye problems. I see well. I don't have any pain in my eye. Why should I have an eye exam? Believe it or not, an eye exam is not only one of the most important aspects of preventative medicine for the entire body and the eye, and the reason for that is when the optometrist or ophthalmologist looks in your eyes, certainly we're looking for the first signs of eye disease, the first signs of retinal tears, retinal detachments, glaucoma, macular degeneration. But maybe even more importantly than that, we're looking for telltale signs of systemic health problems. Things like hypertension, diabetes, atherosclerosis. Even pending strokes and brain tumors can show up on a routine eye examination. Thyroid problems, sexually transmitted diseases. So a whole host of problems can show up on a routine eye exam. So you can see clearly now that an eye exam may not only be vision-saving, it could be life-saving. So the gist of this story is if you haven't seen your eye doctor lately, get in for a comprehensive eye evaluation. Make sure your eyes are dilated. That's very important. With that, we're going to take a tour of the Lange Eye Institute.
My personal feeling is he's the best eye doctor in the world, but he's also a nutritionist, and he takes a real personal interest in all of his vitamin products, and he's constantly improving them, adding to them. I had a heart attack over 20 years ago. I have pacemaker defibrillator, but I have AFib, congestive heart failure, all those good things. And the fish oil and the vitamins, I believe, is maintaining me that I can still go out and run a half marathon. Without those vitamins, there's no way I'd be still doing those things. I'm 80 years old, and there is just no way I would be in the condition I'm in, especially with the heart problems that I had. I believe his fortified line of vitamins are absolutely the best in the world.
First room over here on the right is a room that we use something called an IOL master, corneal topographer. This is technology to actually measure the eye prior to cataract surgery, to calculate the implant that we would use in your eye so you have very good results so you see clearly after cataract surgery. But also for those of you that are wearing sophisticated and complicated contact lenses, things like keratoconic contact lenses, scleral contact lenses, synergized hybrid contact lenses, the mapping system helps us to determine exactly what contact lens is going to fit in harmony with your eye.
I've been a patient of Dr. Lange for about 1.5 years, and I really like what he's done. He's saving my eyesight. He said I had early macular degeneration, and if we caught it in time, I would not go blind. And I think we've caught it in time. You need to take care of your eyes, just like you need to take care of your body, no matter what you do. It's important to survive and be careful with what you put into your body. It's a machine. I take the 4 to 5 vitamins every day, and I am experiencing nothing but pleasure. It's not invasive, it's very helpful, and it makes me feel like I'm younger. At least I can see better.
When I come to see Dr. Lange, it's not like going to the dentist. I come down here and it's a pleasurable experience because he's such a personable guy, and I feel he really is concerned about my eyesight. My wife and I have been taking Dr. Lange's Fortify vitamin line for as long as we've been coming to see him. And one thing we've noticed that our prescriptions for our glasses have gotten weaker and weaker, and we both attribute that to the Fortify Focus. I save my past prescriptions. I always throw them in the glove box just in case I was going to break a pair of glasses. I want to be able to drive home, and I keep a spare in the glove box. But I put those on once in a while, and oh my God, what a difference. We feel that the difference is the Fortify Focus that has improved our eyesight.
Okay, now we're going to step into our pre-test room, and this is where all of our patients stop initially, and this is some pretty cool technology. This first is called a CT80, and this is called a non-contact tonometer, and a lot of you know that because it's the puff of air. It blows into your eye and it reads the pressure very, very accurately for our doctors. So it helps us to determine if your pressure's high or pressure's low. That helps us determine if you're at risk for glaucoma. And then next to us is a Topcon KR8000. This is a really sophisticated, what we call autorefractor and autokeratometer, and it measures your prescription for your glasses very accurately without you opening your mouth. So it's automated, it gives us a prescription printout, so you see clearly without us putting the phoropter in front of you and going, which is better, 1 or 2, 3 or 4, which can be very frustrating. But we use this as a starting point, and then we fine tune it. And then this is an automated lensometer over here. This actually reads the prescription from your glasses so we know what you're coming in wearing. So this helps our technical staff get you ready for our doctors.
I think vision is important to everybody, and whatever we can do to keep it going as long as we live and age. And Dr. Lange doesn't create supplements to make money. He creates them because he sees patients on a regular basis and sees what they're going through and sees how can he help them. And that's why I think he continually refines and changes his supplement formula, whatever it takes to make it better. And obviously for my husband and I, it's gotten better because our sight has gotten better. So I really believe in his supplements.
Okay, let's go on down the hallway to the left here. And this is in our OCT room and B-scan room. So come right in here. This is really cool technology. It's called optical coherence tomography. And it's really sophisticated technology. And if we look at this, this is a cross-sectional image of the retina. This is a patient that actually has wet macular degeneration. We'll be sending them upstairs to see Dr. Tolentino, probably going to have some injections in their eye of Avastin, Lucentis, or Eylea. Ultimately, we'd like to get this patient in the early stages so we can use some nutrient protocol that I've actually developed here at the Lange Eye Institute, some specific supplements and dietary changes that could potentially keep this from erupting into this wet form. These are cysts in the macula, this wet form of macular degeneration. So the key is early detection. This is what we call a B-scan. And a B-scan is really cool technology. It's basically ultrasound. And this shows the back of the eye, the front of the eye, and we use this oftentimes to help determine whether or not the retina is intact. we have an opacity in the eye, a dense cataract from trauma or just aging, or we suspect a retinal tear or retina detachment, we just can't see it in the dilated eye. This helps us to determine what's going on in the anatomy of the eye. It also is great for detecting cancer in the eye. Melanoma in the eye will show up on this. Once again, remember the key is early detection.
I'm very thankful that I ran into him 25 plus years ago. Ever since then, I feel comfortable about coming and having my eyes checked. I didn't go as often as I should have. I didn't like the doctors, and they had no nutritional program to offer me along with my eyes at my age. And he developed all of this, and I think it's the greatest thing that's ever happened. For me, anyhow. And everybody else should be on some type of vitamin that he offers.
Okay, let's head on down to the next room here. On the left, this is our visual field testing room. This is crucial in a busy eye care practice. Visual field technology has been around for years and years and years. It's just getting better and better and better. A lot of you that are watching this video probably understand the visual field and dread taking a visual field test because it's long and drawn out. Well, the new visual fields take only about 2 minutes per eye, so we're talking 4 or 5 minutes, so that's pretty quick. Basically, you sit in this bowl and you have a little clicker in your hand and you push a button every time you see a light blink, and it plots out your peripheral vision. That helps us as the practitioner to determine what's going on in the eye-brain connection. Remember, you see with your brain, not your eye. The eye is the organ that transmits the signal to the brain via the optic nerve. So this technology is great for diagnosing and following glaucoma, but for picking up patients that have had strokes, patients that have had traumatic brain injuries, patients that have brain tumors, aneurysms, patients with double vision, that's called diplopia. We can run this test and it can help pick up neurological problems in the early stage. And once again, the key is early detection.
Trust to me is a big factor in talking to anyone. I have to have trust in them before I feel like doing what's suggested. And trust has never been an issue with Dr. Lange and myself. He is very informative. He discusses our eyes with us, transformations about what's happening in our eyes, any issues we have concerning our eyes. He explains the various tests. He gives a lot of tests. And I feel comfortable that he's doing all he can to help us.
We have 10 examination lanes. They're all basically the same. So we have a slit lamp or a biomicroscope, a phoropter, an indirect, some direct ophthalmoscopes, fully computerized electronic medical records. And my technicians will usually do a lot of the preliminary tests on you and then bring you back into the exam room and start doing some testing that I don't need to be doing to gather a lot of data for our doctors.
I'm very thankful for the vision that I have right now, and I can contribute a lot of that. I mean a lot of that to Dr. Lange and his interest when I come in. I take Fortify Eye every morning, and I just think they improve my vision all day long.
So there's a whole host of contact lenses today. If you've been considering contacts and been told you could not wear contacts for whatever reason, your eyes are too dry, you have astigmatism, that's really not the case. If there is a will, if there's a desire, there's a way. So if you're 5 or 105 and you have the desire to wear contact lenses, we can fit you in contact lenses here at the Lange Eye Institute.
I've been on the Super Omega, the fish oil, for about 5 years now, and it's just been a benefit to me. And I have recommended that to friends of mine to say, you know, it's been working for me, and I would encourage you to consider it. As a patient of Dr. Lange, I'm thankful that I do come to see him on a periodic basis, and will continue to do that and recommend Dr. Lange. His knowledge is impeccable, and it just helps me to, I feel very comfortable with Dr. Lange and follow his guidance.
All right, we're going to go into a very special room here at the Lange Eye Institute that houses something called the Anitas RHA. State-of-the-art technology, crazy expensive. There's less than 100 of these in the world. There's only 3 of them in the state of Florida. Most doctors and most places are not going to invest in this technology because there is not a Medicare code they can't bill for it. I invested in it because the key is early detection. Since I'm involved in a lot of macular degeneration studies and treatment protocols for natural approaches to macular degeneration, I want to detect your macular degeneration before the doctor can see it. One of the key factors with this piece of technology is helping us to detect Alzheimer's, believe it or not, dementia, Alzheimer's of the brain, not the eye. Because there's 3 things that we look for in Alzheimer's patients. Cortical cataracts, this will not pick it up, but we will with the slit lamp. Nerve fiber layer thinning and drusenord bodies, this will pick it up. Also, this has autofluorescence. It picks up a metabolic waste product in your eye called lipofuscin. If you have that in the eye, you can have it in the brain. So you can see clearly now why the Anitas RHA is one very good form of preventative medicine. It's about $40 to have this test done.
My eyes were out of focus, and I came to see him, see if I need cataract surgery, and he advised me to get a cataract surgery, which I have done. It made a terrific difference in my life. I can see brighter and clearer. Everything looks brighter and clearer thanks to Dr. Lange. He is a fantastic guy and a fantastic doctor.
And what we have in here, this is a Zeiss VisuCam. This is a fluorescein angiogram device where we can actually inject the dye called fluorescein and then take some images of your retina to see if you have any leaky blood vessels. This is great for wet macular degeneration, for diabetic retinopathy, for branch vein occlusions, artery occlusions. And then right over here, this isn't on, but this is called their diopsis, VEP and ERG. It stands for an electroretinogram or visual evoked potential. VEP is amazing technology for glaucoma. We can help detect glaucoma in the earliest stages with this technology, and the electroretinogram helps us to determine kind of the horsepower of your retina. Helps to look at our protocol, our treatment protocol, to see if it's working, to see if your retina is actually functioning better without you saying a word. You have some electrodes placed around your eye and your forehead, and you sit down and you watch a television screen basically, and it tells us everything we need to know. So once again, visually evoked potential for glaucoma patients, electroretinograms for retina patients, very diagnostic technology here at the Lange Eye Institute.
I think young people, they wait so long to get started on vitamins that sometimes their body is already in trouble. So they need to do this earlier. As a young person, you should start taking vitamins now because of the importance of your eyes. Don't wait. I was over 40 before I had been described that I had macular degeneration. Had I been taking vitamins all along, I may not have had any trouble with my macular degeneration and not had a problem with it. So you should take vitamins when you're starting maybe 20, 25, and when you're working, and that's very, very helpful.
So in here, we have a variety of ophthalmic frames, ophthalmic sunglasses for you to pick from. After you see our doctors, they'll give you a prescription. It'll come into the computer system here. Our opticians will help determine what frame looks best on you, due to your facial features and characteristics, what color is going to work best for you. So that's what they're trained at, finding a frame that is in harmony with your, self-image. So you can bring your prescription over here, you can bring your glasses, we can duplicate your prescription, or you can see our doctors at the Lange Eye Institute and come into the Lange Eye Care optical gallery and let one of our opticians help you. And then right over here is kind of a nutritional area. All of these vitamins I've actually developed with the Fortify vitamin label. I've done all the clinical studies for these supplements, and I've been doing this for about 20 years now. And we have supplements for macular degeneration with omega-3. We have supplements for digestive health, enzymes, and probiotics. So make sure you stop by the Lange Eye Institute nutritional area as well, and certainly talk to the doctors about what nutrients are good for you.
On Saturday mornings, when he's on the radio, no one's allowed to say anything in the house. I said, don't talk to me until after the radio show is over. I have to listen to what Dr. Lange has to say because he's so knowledgeable and because of my interest in nutrition and alternative medicine. I promise you, you will never regret taking Dr. Lange's Fortify vitamins, the whole line of them. You will notice the difference and you will feel better. Guaranteed. I guarantee it for Dr. Lange. And this is coming from a patient and from someone that has taken Fortify vitamins for years. And believe me, I know what I'm talking about.
Let's walk right over here, and I want to introduce you to a lens that I helped in the development of. This is a company I developed called Blue Light Defense and Blue Light Shield. We've all heard by now, hopefully, about the detrimental effects of blue light. Blue light is everywhere. Any man-made light emits a frequency of light between 400 and 500 nanometers. The computer, the iPad, and the iPhone is detrimental to our eyes. That blue light can actually accelerate cataracts, but worse yet, accelerate macular changes and actually cause a form of macular degeneration. So, this is a lens called Blue Light Defense or Blue Light Shield that filters that harmful blue light, and it's clear. Unlike a lot of the competitors that have a yellow and a brownish and an orange hue, these are totally clear. So let me show you the first lens. This is one of the competitors that claims they block the blue light. Here's a blue laser, and watch this. It goes right through that lens. See that? Now, this is Blue Light Defense, a clear lens. Watch this. It's filtering and blocking that harmful blue light. This lens material is in the monomer, it's not a coating, and it can be made into a progressive lens, a bifocal, or single vision. I recommend this to your children at 5 years of age, if they're on the computer at younger age, very young age, all the way up until 1 foot in the grave, using this material when you have your glasses. It's called Blue Light Defense or Blue Light Shield, exclusively through the Lange Eye Institute.
We've been taking 4 or 5 vitamins for probably 6, 7 years, I would say. And we take, in fact, we use all of his products. We have lined up on our kitchen sink all of Dr. Lange's products. And they have definitely helped me. I'm 84 years old. If you're going to live to be 84 years old, you better take care of your eyes, because if you can't see, you can't do anything. It's going to wipe you out completely. So eye care is very important. And with a doctor like Dr. Lange, he can look in your eye and see other things that are going on in your body, which is very beneficial. And I trust if he looks in my eye and says there's something going on in there, I believe him.
Lead the revolution in diagnosing AMD earlier with the help of the AdaptDX Pro by Maculogics. This cutting-edge medical device leverages the science of dark adaptation to help you detect macular degeneration up to 3 years before drusen are visible. A subclinical diagnosis gives you more time to slow the progression of AMD through intervention strategies, and it gives your patients more time to do the things they love. Simplicity and efficiency make the AdaptDX Pro an obvious choice to benefit both patients and practices. The lightweight headset was custom designed and tested for patient comfort and ease of movement. The AdaptDX Pro features the first onboard technician named Thea, who coaches your patients through the test.
Hello, I'd like to introduce myself. My name is Thea, and I will be guiding you through today's test.
Driven by artificial intelligence, Thea's real-time guidance adapts to each patient to ensure consistent, reliable results.
You may press your response button at any time to start the test. Very good. I will measure how fast your eyes adjust from daylight to darkness. You may close your eyes now for a few seconds. I will tell you when to open them.
The intuitive interface on the LCD screen makes it easy for eye care technicians to get patients started. Once the test begins, Thea takes over, and your technician is free to care for other patients or to handle other important tasks. And light ceiling eye cups eliminate the need for a dedicated darkroom, so patients can take the test in any light. The portable device delivers a more efficient test that can be done anywhere, making it easy to integrate with your unique workflow. You'll also find that AMD testing with the AdaptDX Pro has a positive effect on your practice. Your AMD patients return for more frequent follow-up testing and imaging to monitor disease progression. There will be opportunities to prescribe preventive treatments, including nutraceuticals and protective lenses that can drive additional revenue. This is your chance to improve patient access and care while accelerating the growth of your practice.
Congratulations, you finished the test.
To discover how the AdaptDX Pro can change the future for your practice and your patients, contact the AMD experts at MacuLogix.
Your technician will be with you shortly. The iLux system is a device designed to treat patients with meibomian gland dysfunction, or MGD. It is the leading cause of dry eye. Dry eye is caused by deficiencies in the quantity and quality of meibum or other tear components within the tear film. Around 30 million people are estimated in the United States to suffer from dry eye symptoms. According to a study, 86% of dry eye sufferers are reported to have clinical signs of meibomian gland dysfunction. Healthy meibomian glands produce clear and liquid meibum. Dysfunctional glands produce meibum that is either cloudy or thick and paste-like. In some cases, the glands do not express any meibum when compressed. This may indicate fully blocked, capped, or damaged glands. The iLux system allows eye care professionals to target dysfunctional glands and improve signs and symptoms of MGD using localized heat followed by compression therapy. To clear the glands, the eye care professional positions the iLux device on the eyelid and applies light-based heat to melt the meibum. Compression of the lids after heat therapy allows the eye care professional to express the unhealthy meibum. When the blockage is cleared from the unhealthy glands and/or clear healthy meibum is seen on the lid margin, the procedure is complete.